Hello, everybody. Welcome back to How Come. Oh boy, today is a very special episode. This is How Bald Part 2. We are starting with the congrats from Sydney, who's a companion who just shaved her head for the first time. And we're going to find out why. And then we are talking to my dad, Dr. Joel Kassimir, who is a board certified dermatologist with 42 years of experience. He does hair transplants. He does hair regrowth. And yeah, that's what we're talking about today is hair from the perspective of a medical expert who has also gone through hair loss. We learn different reasons why people lose hair, how to get it back. Any question that you guys had, the companions submitted so many questions and such good questions. And yeah, you learn a lot. So first we are starting with Sydney and then bringing out me and Charlotte's dad and our brother's dad, but you guys haven't met our brothers yet. Anyway, we're bringing out our dad. He's also Nanny's son, Dr. Joel Kassimir, and so excited for you to meet one of my parents. We'll have to have my mom on some other time. And yeah, thanks to BetterHelp for supporting How Come. For 10% off your first month, go to betterhelp.com/howcome. Start living a better life today. Okay, so first we're going to hear from Sydney, and then we're going to hear from my dad.
How come? How come? How come I can't achieve? How come I can't achieve? I'm rolling up my sleeves. I'm rolling up my sleeves. Oh baby, I believe these guests can help. 'Cause I can't do it by myself. I wanna jizz.
Sydney, are you here? Hi!
How's it going?
Good, how are you?
I'm good.
Do you want us to call you Sydney?
Yeah, Sydney is fine.
Amazing. And do you want your face to be able to be seen by Patreon?
Yeah, it's totally fine. I'm a Patreon myself.
Yay, love it. Okay. Oh, also, you guys, we finally made the Patreon Discord work.
Yeah.
Hooray. Thanks to Robin.
Looking forward to actually.
So fun. Me too. Okay. Welcome, Sydney. I'm so excited to have you here.
I'm excited to be here.
It's so nice to see you out of the Discord.
Yeah.
And see this famous haircut we've been talking about for so many months.
It's actually a lot longer than it was when I originally got it cut. So I'm really tempted to just shave it all off again.
Amazing. Tell us about the hair shaving. What did you do it for? How long had you been thinking about it?
Yeah. So I have donated my hair several times in the past. This most recent time, have been thinking about it for probably about 5 or 6 years now. And I was like, when I graduate college, it'll be a good time for a change. I'll be going into a professional field. And I wore my hair up all the time anyways, because I don't like having my hair in my face. I don't like it touching my face. I don't deal with any of that. So I always just had it up in a ponytail or a braid or a bun or something. And I was like, all right, I'm going to donate it. And it was a matter of me being well, I used to donate to Locks of Love, but they've been doing some kind of sketchy stuff and I don't really like them anymore. So I decided, to look in some other charities, and I found Wigs for Kids, and they actually work with several salons. So if you go through their website and you make an appointment through their website with one of their affiliate salons, you get a free haircut.
Cool.
Which is I'm about that. I'm a broke college kid. Free haircut. Let's do it. So I made.
Wait, when was the first time that you donated?
The first time I donated, I was in the 6th grade.
Holy shit.
Yeah, I donated 26 inches and I had about 28 cut off in total. So my hair was up to here. When it was finished cut, it was here, but when it was way down here.
Oh my, that's so extreme.
Just massive chunks of my hair. I think every time I go, the hairdressers are either really, really excited or they're I'm going to cry. Yeah. This is so dramatic.
And had anybody that you knew donated or you just had heard about it? What inspired you?
So I knew a couple of people in my neighborhood that I grew up with who would grow out their hair and donate it and stuff. And I thought that was really cool and went to a really good cause. And I was yeah, let's, I can do that. I have enough hair. I can just lose it. And I've never been very, attached to my hair. I've never been it's part of me and it's what makes me, pretty and feminine. I'm pretty because I got a face.
And also, I feel when your hair can grow to those lengths, you maybe take it for granted.
Yeah.
Because it's like, yeah, I can cut it off, you know, like it'll come back.
Yeah, it does. Like it gets so long and I'm just like, you know, it's heavy at that point. I'm just like, there's so much of it. And my hair is like a weird texture where it's like it wants to curl really bad, but it's like too heavy and it doesn't. So it just ends up with like really messy waves and it's hard to like control it.
Mm-hmm.
So it's easier just to cut it all off.
Yeah.
What was the issue that you said about locks of love? Because like before this, that's like the only one I've ever heard of, and the one that I was always like, oh yeah, someday I would love to donate to them, but I couldn't because they have a stipulation about dyed hair, and I've been dyeing my hair since like 7th grade.
Yeah. So Locks of Love is supposedly running as a nonprofit, but if you go through their like financial records, because if they're a nonprofit, it is public record. I think they have them from 2018. They had like over $20,000 in profit as a nonprofit.
Whoa. That's wild.
Yeah, and
in 2013, they had $6 million of like unaccounted for, unused, donated hair.
Yeah.
So it seems like they've definitely had a few scandals.
Yeah, they've also had issues with that. They're also I don't like their application process either. So their application process is for like basically you have to have 2 letters of recommendations from a doctor, and then the parents have to write an essay on like why their kid deserves to get a wig. And I'm like, why do you need like a letter of recommendation, like 2 letters of recommendation?
Why do you need like a college essay?
Another thing that Locks and Love has done is they tend to say like they advertise as themselves as like, oh, we give wigs to cancer patients, but they actually don't. So they actually only give wigs to people who have permanent hair loss conditions like alopecia. What? But they use like cancer kids as like a way of getting hair.
Not that alopecia isn't valid as well. Like I know people with alopecia and like, go get your wigs, everybody. But I feel like using cancer patients as like the poster child when like that's not the majority of who's receiving the goods is pretty flagrant.
Yeah, it's really shitty. There's a YouTuber that I love called Illuminati who does a corporate casket on them, and she goes through all of it with a ton of research and stuff of being like, this is why this place sucks.
And then your place was called Wigs for Kids?
Yeah, so
okay,
it's Wigs FOR Kids, because there is a Michigan-based one that uses the number 4. And it's a much smaller charity, and it's basically only works within like Michigan, which is fine if you're in Michigan, but I'm in Southern Ohio. So I have a bunch of pictures from it because we were actually planning on taking my graduation photos that day. So my sister went with me. She took a bunch of pictures. She got to cut one of my chunks of hair off.
So fun.
Oh yeah. And then we went and we took a bunch of graduation photos and stuff. I don't have them yet because my sister takes forever completing tasks.
Will the task be good when it's done?
Yes, it will be probably.
Then she can take her time.
Yeah. Right? I'm like, honestly, like I took graduation photos because I didn't walk and I was like, mom's going to want something. So like, I'll take some graduation photos and it'll be a nice opportunity for me and Matt to get some good photos together. Matt is my significant other.
And did you do the pictures pre-cut or post-cut?
Post-cut.
Okay.
So all of my graduation photos, I have a shaved head and stuff. And then I think the funniest thing about that day is I forgot it was my mom's birthday. So I didn't tell my mom. Me and my sister sitting there, we finished up watching the movie. And she's like, oh, mom and dad should be back from like their dinner for her birthday. And I was like, oh shit. Because I didn't tell my mom. I didn't tell my dad. I told some of my friends, like, I want to do this, but I didn't tell anyone in my family. And then we like video called my mom. My mom's like, you look weird. What did you do? And I was like, nothing.
Wait. Had she ever seen you with a shaved head before?
No, this is the first time I've ever shaved my head.
This is the congrats.
Yeah.
This is it's like you've donated hair before, but this was like getting down to the stubbly bubbly.
Yeah.
For some reason, I feel like parents take their kids' hair like so personally.
Yeah. Like she's never mad at me when I donate my hair or like if I cut my hair really short. It's just most of the time I give her like a heads up, like, hey, I'm gonna go get a haircut. I'm gonna like go like donate my hair and stuff. She's like, okay, cool, whatever. And I think this time she was just like upset that I didn't tell her beforehand. And it was just kind of like a hi, whoops, surprise. And then my mom proceeded to not tell anyone.
She was like, everybody needs to have the same reaction as me. Like, I don't want them to have a heads up.
I know. My mom keeps making jokes like, you are your dad, because my dad would do that. My dad would be like, oh, I'm going to go get a haircut. My mom would be like, okay, thinking he'd get like a trim or something. And then he'd come with like IBEW shaved in the back of his head or something for the electricians union.
When I went platinum, my dad was like, your hair's going to break.
No, I can't tell you the number of people that I told like, hey, I want to cut my hair. I want to shave my head. I want to donate all my hair. A lot of the guys that I worked with, because I work in construction a lot of the times, they're like, you're going to look like a boy. Like you're not going to look pretty anymore. You're not going to be feminine anymore. And I'm like I give a shit.
So many women and AFAB people and non-binary people like can shave their heads and look super hot, but even if like that other person doesn't think so, like you feel good. Yeah. You know, like, do you feel hot?
Yeah, it's like it was honestly like the most amazing feeling to be like, I don't have any hair, I feel good, I look good, I'm killing it. Like I was ready.
No more painful ponytails.
Oh god, yes. I did get like phantom pains for a little while, like ponytail pains from like, and I got those for a while and I was like, I feel like my hair is pulled back really tight even though I know it's not. And like,
yeah,
it was a weird sensation. I still get like random thoughts where I'll be like, oh, I'm gonna go work out. I'm like, I need to grab a ponytail and throw my hair up.
I can't even imagine.
It's like, what hair? I can't even use like a headband. So I'm like, I don't know where this thought is coming from.
So funny.
The one thing is though, if anyone ever shaves their head, you will figure out where you have colics. Because I have two in the back of my head. You can see like here, like it wants to pop out. And then this just goes.
I've literally thought about shaving my head just so I wouldn't have to deal with my little cowlick anymore. Like sometimes I hate my cowlick so much I put it in its own ponytail.
Yeah.
A little unnecessary pony. We love to see
That's
it.
what I was going to say.
But now I'm like, no, it would just be even more noticeable.
I mean, it depends on how short it is. So when I first shaved my head, I had a foreguard on top, which is about 1/2 inch. And I had a two on the side. And like, it was completely fine. You never noticed it. It was never an issue or anything. It wasn't until I started kind of growing my hair out again.
Do you like it this length or do you like it shaved better?
I like it shaved just slightly better, but I also know like winter's coming and I live in Ohio. So my head's going to be cold if I don't.
So are you going to grow your hair back out again? Or are you going to keep like keeping it like short and maintainable for a little bit now?
My plan right now is I'm going to keep it short and kind of maintainable for a little while, probably like a year or so. And then I might start growing it out again. I've also been debating like once I get a job and I start working and stuff, maybe dyeing my hair a weird color because I've never been able to dye my hair because of donating it. So I'm like, I kind of just want to do this really quick. And then like I can cut all the dyed parts out and it's not an issue.
Yeah. And you can do all the colors or you could shave your head, get a tattoo on your bald head, grow your hair out. Nobody knows it's there. Ugh, the dream.
Oh, yeah.
Whose dream?
Mine. I've always wanted a hidden dolphin tattoo on my scalp.
I know.
That no one knows
For
about.
what reason?
For fun?
Because why not? Like,
yeah.
Yeah.
You've got your hair tied up and it's just got like a weird little strand going the wrong direction. And someone's like, what the fuck is on your head? It's just my dolphin tail.
It's my dolphin.
Yeah. I'm in a professional like group for women in construction, and one of the ladies' daughter has a completely shaved head, and then the back of her head all the way down to the back is a phoenix, and it's like super beautiful. And her mom's like, oh my god, and she's like, I can just grow my hair out and no one will see it, it'll be fine.
Literally.
It is true. My mom would like cut that piece of skin off if I came home with a tattoo on my scalp.
I just don't tell my mom. I just show up with them. Like, I didn't tell my mom about any of these piercings. I have one through the whole part of my ear. These ones, I didn't tell her about my tattoo. I just like show up with stuff. And she's like,
you didn't tell her about your shaved
head?
head?
I didn't tell her about my shaved head. Just I just show up and she's just like,
Sometimes that really is a good policy though, because like my dad is like, he was always like, don't get extra piercings, don't get tattoos or whatever. And like when I got my extra piercings, he was like, oh, they're cool. And like when we got our tattoos, he was like, oh, it looks nice. You know, like sometimes they just like, it's like Ben.
It's
Whenever
like
I want to
us
like
cool.
reorganize the house, he's always like, don't do that. And then I just do it when he's gone and he's like, oh, it looks really good.
yeah, basically. That's my mom's the same way. My mom's like, oh, don't do this, like da 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 da. And then like now I have my industrials in and stuff, and she's like, we'll go to the mall and stuff, and she'll be like, oh, let's look at jewelry for you. Like, this is cute.
We're growing. Does the charity that you donate to, do they tell you anything about the person that's going to receive the hair?
You can. I chose to donate anonymously, which means I just gave my hair. There's no connection. It's just kind of like a thing. But you can also fill out a donation form and they'll contact you about, you know, how they used your hair and what wig it got put into. The wig creating process isn't exactly a one-to-one. It actually takes about 17 hair donations to make one wig.
Whoa.
And that is because it's better than Locks of Love. Locks of Love use like 340 some hair donations to make a wig. So like,
why?
For what reason?
I don't know. I can't tell you. But because part of the process is they have to go through and get rid of all of the like weaker hair and hair that's more damaged so that they only end up with the strongest hairs. So that kind of weeds out like being like, oh, I donate a whole head of hair. So obviously it's going to make one whole wig. It's like, well, you might make like a quarter of a wig or like 1/17 of a wig. And
that makes sense.
And a lot of places they sort the hair by color, so they'll be like, oh, here's like really light blonde, here's a dirty blonde, here's brunette, here's a darker brunette, into like black. So what they'll do is they'll kind of just put it into a bin and then they'll like kind of mix the hair so you get a little bit more natural coloring. If you want to know about the hair industry, Refinery 29 did a like 12-minute mini documentary series on it. You can find it on YouTube. It's really interesting, like the ethics behind like wigs and hair extensions and stuff.
Yeah, I also really love Chris Rock's documentary, Good Hair. Like super good. Have you seen that one?
I have not.
It's really, really good. It talks about the whole industry, the bad stuff, the good stuff. It's really funny because he's him. Yeah. But also it's like, it's really real.
Yeah. It's a weird thing to be like, this is a thing. And
like there's a lot of people who are like not donating their hair, but selling it because they need to survive.
Yeah.
And then a whole other economy of buying hair.
Yeah. You know, and it's like, you know, you get hair and you don't know exactly where it came from. You're just like, oh, okay.
In that doc, actually, he says that the most coveted type of hair is from India, and it's called what?
Remy hair.
Remy hair.
Yeah. Yeah. So it's like it's a weird thing to be like, oh.
Yeah. Congratulations on donating again.
Thank you. And
congrats on finally taking the shave plunge.
Yeah. I would definitely recommend it to anyone who's been like thinking about it. Like just do it. It feels amazing. It's so nice. You get like the peach fuzz hair, so you can like, it feels real nice just to rub it, especially if it's like hot and it's summer. Like I think this is probably the best summer I ever had because I was like, oh, I don't have to do anything.
Yeah. Oh my God. There's no fucking neck sweat or like curly under hairs.
No. And it stays in one spot for the most part. I'm really excited for some of the pictures that I took with me and Matt, my significant other, because like we both had the same haircut. We both had buzzed heads and he still has his, but I've let mine grow out a little bit. And I'm like, but we looked so cute. We were matching.
Yeah. I love that. Does he, obviously he's into it. He loves it.
Yeah. Oh yeah. He was amazing. Supportive through all of it. We offered him one of my little strands to cut and he was like, oh no, I'm way too terrified to cut your hair. Like you're going to have a bald spot right there. Like I'll leave it to the professional.
But your sister's like, let me at her fucking head.
Yes. My sister's like, I will cut all of them off if you let me. And I'm like, let's back it up a few.
But another thing for people, if you have dyed hair and you cut your hair, you can put your hair outside and birds will take it for their nests.
Very true. I've heard rumors of like specific charities taking dyed hair, but I have not been able to find them, and I don't know where they're at. I'm like, unless they're like the tiniest of them. I know you can, if there's an oil spill, you can donate your hair to oil companies and stuff, and they'll use it to clean up oil spills. So a lot of hair charities.
Cool.
Yeah, a lot of hair charities like Locks of Love, Wigs for Kids, they work with the oil industry so that if they ever have excess donations that they don't need or ones they can't use, they give them for oil cleanup process.
Unreal.
So they basically just like stuff human hair into like pantyhose because it floats, and they just tie it off, and it's really good at absorbing oil.
That's so interesting.
I know a lot about hair.
I'm so glad we know this now. Well, Sydney, we only have a few minutes left, and I don't want to get you cut out. Thank you so much for sharing this story, and thank you for doing what you're doing. It's really awesome, and I'm sure it's improving a lot of lives or getting rid of oil spills we don't even know. But yeah, you're awesome.
Thank you so much for having me. It was like fun talking to you guys.
I do have to ask you, after a sexual experience, which, yeah, this has been sexual. Why not? A shaved head is sexual, you guys.
Yeah.
So Sydney, you sexual beast. Did you finish?
Yes, I did. Did you finish?
Amazing. I did. Thank you so much for asking.
Yay.
Rob, how about you?
Always, man. Always.
Amazing. Amazing. Thank you guys so much for coming. Or Sydney, thank you so much for coming.
Yeah, thanks for having me.
You're welcome.
Rob, thanks for being here and doing your job.
No problem, man.
Goodbye.
Bye.
Ugh, learn something new every time on this pod. At least I do. Oil slicks? Who knew? Not me. Sydney. But yeah, this is an episode chock full of learning. If that wasn't enough learning, then buckle your seatbelts because we're about to learn so much from my dad, who really, he is like a star in his field. This is a living legend. We're very lucky to have him on this podcast, just giving us free knowledge. And that's very him thing to do because he's always raised us saying smart is cool. And yeah, this is a very smart and cool episode. You know what else is smart and cool? Therapy. Yeah. Keeping on track with feeling good, because there can be a lot of stuff that interferes with your happiness or prevents you from achieving your goals. And BetterHelp will assess your needs and match you with your own licensed professional therapist who you can connect with in a safe and private online environment, which is the most convenient thing. I love it. You can start communicating in under 48 hours, all without ever having to sit in an uncomfortable waiting room or commute. Who wants to commute? Not me. BetterHelp is committed to facilitating great therapeutic matches, so they make it easy and free to change counselors if needed. Anything you share is confidential. BetterHelp is convenient, professional, and affordable. It is not a crisis line. It is professional counseling. And they treat lots of things. They have therapists specialized in depression, anxiety, family conflicts, trauma, anger, grief, self-esteem, sexual or gender identity. So many things that you can just tick off, and then that person is the right person to work on that with you. I love BetterHelp. I think it is really accessible, really affordable. New York City therapists are super expensive, and a lot of times I would be like, I'm not even worth doing this. And when you're already in a low place, that's not a good feeling. So to be able to just download an app and easily sign up and have somebody at the tip of your fingers really quickly is awesome. So if you want to start living a happier life today, get 10% off your first month at betterhelp.com/howcome. Join over 1 million people who have taken charge of their mental health. That is betterhelp.com/howcome for 10% off your first month. Thanks, BetterHelp. And thank you guys for listening, whether you are a longtime companion or you're a newcomer. We're so happy to have you here. So excited for this episode. I know a lot of you probably came for the hair god. But yeah, if you like this episode, please rate, review, subscribe. It means so much to us, and it puts us higher on the charts, and that way other people can discover us and they can start feeling good too in so many ways. All right. Now I'm going to introduce you to Dr. Joel Kassimir, a.k.a. Dee Dee, a.k.a. Jim, a.k.a. our dad, and leading medical professional in hair and dermatology. Here we go. Hello, Dee Dee.
Hello, pretty Remy.
That name holds me to a very high standard.
Well, it's been your name forever.
So get used to it.
A rose by any other name is still a rose.
So true.
Right?
When I named you Jim, still a great guy.
That's it.
I renamed our entire family when I was like 5.
And we went along with it.
Yeah. And I renamed myself. I was Kelly. Had to make me lunch bags at camp that said Kelly. So exciting to have you here.
Very nice to be here.
Welcome to How Come.
Thank you for asking.
We did an episode, as you know, about my friend Dylan balding. And I was like, we should get an expert on, which is you.
Correct.
What made you want to go into hair transplants or dermatology in the first place?
It was an accident.
Okay.
I started in general surgery, and I was going to go on to plastics. And when I was a young resident, I was losing my own hair.
Yeah.
And I read the whole world's literature, and I said,
Wait,
no.
is that when you started losing it?
I started losing it probably slowly in my late teens, and little by little, it was very incremental.
Very incremental.
Excuse me. It was,
And like very recedy versus
Yes.
like a bald spot in the back or
right.
like
It receded slowly.
you have a peninsula.
I have a little bit left. It's more than nothing, but not a lot.
Yeah.
And
And when it was balding, there was always a lot in the middle.
Right. Of course, there's a psychological overlay to hair loss. If you lose it very quickly, it might impact you greater, in a greater way than losing it slowly. And mine was little by little by little. But by the time I got to my residency, I was already reading, the literature, and clearly no one really knew what was going on. And there were a bunch of theories, but it was like a big blank slate.
Of what? Why people were losing hair naturally?
Yeah, what the pathophysiology was of hair loss.
I remember people would say that it was from your mom's dad.
I don't think anybody knows 100%. I think it's unclear exactly what the genetic makeup of hair loss is. It's probably multiple genes. Some diseases are one gene and some are polygenomic.
Is balding a disease?
Well, it's an entity. I don't like to call it a disease, but it's a phenomena.
Like there's like male pattern baldness, female pattern baldness, person pattern baldness, but then there's also like alopecia.
Well, male pattern is usually the one that everyone's familiar with. You get some receding.
Yeah.
You get hair loss on the vertex, which is the bald spot. And then you're left at the most extreme situations with a horseshoe, that fringe around your head. Female pattern is different. Women usually keep an intact hairline, and they usually thin behind that hairline in a generalized manner. So if you ask most women who are losing, what bothers them the most is the area right behind the center of the hairline. And almost every woman that I've ever treated surgically, that's the area they want filled in. And those treated medically, that's the area that they want to respond the most, because that's the area that everybody sees. The center, right behind the hairline. So the fact that women keep their hairline is much, much more strategic, because they look better until a certain point than guys will, certainly because that hairline is intact.
How do you fix the...
Well, medically, remember now, when it comes to male and female pattern hair loss, you're treating something that's hormonal.
Yeah.
Doesn't mean that there's anything wrong with your hormones. Your hormones can be perfectly normal, but it is hormonal in that it triggers the hair loss process. And that is based on, we believe, molecular receptors that this hormone will bind to. So you may have the normal amount, but in those areas that are sensitive, like the top of a man's head, or generalized on women, the hormone that causes the hair loss will bind to those receptors.
So what do you have to do?
Well, this is hormonal hair loss as opposed to antibody hair loss. So
What's antibody hair loss?
We'll get there. Hormone hair loss is when you convert testosterone into dihydrotestosterone. And that's the prevailing theory, and it appears to be correct.
You're not putting things in layman's terms.
Well, it's hormone A being converted to hormone B.
Uh-huh.
And those people who can convert it into hormone B and have the receptor on their hair follicle. So, you have about 100,000 hairs on your head. And actually, redheads have a little bit more.
Oh.
And because their hair is a little thicker. And blondes tend to have a little bit less because it's finer.
Mm-hmm.
And brunettes are in the middle. But it's mostly 100,000 hairs on everyone's head.
Mm-hmm.
And let's just say once that hormone B binds to the follicle and triggers the loss, it falls out. And then the next growing cycle, it comes back shorter. So it doesn't disappear, but it comes back a little shorter. And over the years, little by little, it gets shorter and shorter and shorter.
What do you mean shorter?
Well, for instance, normal hairs grow for about 2 to 6 years.
Uh-huh.
And they grow at about a half inch a month.
Uh-huh.
So a half inch a month, so means your friend who shaved his head, let's say it
Dylan.
was down to the scalp, it would take a half inch a month for 12 months or a year to grow just 6 inches, right? So if you're a woman and you have long hair down to your shoulders, let's say that's 2 feet long, that would take 4 years to grow back, 6 inches a year. So, but let's say with each hair cycle, the hair grows 2 to 6 years and it falls out. But
So it's making the cycle shorter, not the hair shorter.
That's right. Well,
Okay.
Both. But let's say the subsequent cycle is 1 to 3 years, and then 6 months to 12 months, and each succeeding cycle gets shorter and shorter. So if you comb through your head, you'll see long hairs, you'll see medium hairs, you'll see short hairs.
Different types of cats. If you comb through your hair,
That's right.
you can see short hairs. You can see
Yeah.
grace.
Well, that's
You can
true.
see moo.
And those short hairs are usually hairs that used to be longer. And if you have a lot of those short hairs at the base, so anybody can go to the mirror now and take a comb, and you can comb through your scalp, and sometimes somebody might be able to see it better if they're standing over you.
Yeah.
But if you're combing through someone's scalp and you look to see if there's these little 5 or 10 millimeter hairs, very short, but they're not gone. Those hairs generally used to be a lot longer. And when the hair loss process started, those hairs were longer and they fell out and they got shorter. And that's how you can sort of figure out what their status is. What's left for me to, what can we do medically to retrieve those hairs? And what if we take a 5 millimeter hair or a 10 millimeter hair and turn it into 1 or 2 or 3 or 4 inch hair over time with medication? Dermatology was changing. It used to be considered a subspecialty of the Department of Medicine, like many other things, hematology, cardiology, rheumatology, GI. And there are many dermatologic manifestations of systemic diseases. But now it was becoming more surgical as well as cosmetic.
yeah.
Because they were
Botox.
Yes, Botox also. And then, they were starting with collagen, and collagen went on to a variety of products like Juvederm and Voluma. There's lots of different products available to treat wrinkles and photo aging, topicals as well. But it was also doing Mohs surgery, which was for microscopically controlled removal of skin cancers, which made it 99-point-something% precise. So
That's cool.
So yes, and then the whole laser world started, and that was also part of dermatology. I got interested, and I applied to a dermatology program, a very fine program, and they took me. I think I was the first surgeon they took, as opposed to somebody who came out of a medical background. And it was very good to have the surgical background because
You do a lot of surgeries now.
it's in the 40 years or so, since I came to dermatology 41 years ago, it has blossomed.
And transplants too.
Hair transplants are incredibly interesting now, because in the 1930s there was a guy in Japan named Okuda who first described hair transplantation by taking a trephine. It's like a thing that you'd use with Play-Doh.
Yeah, a little
And
cylinder.
He was taking some hair from the side and putting it on the top. And the hair grew. And the reason the hair grew is because the hair was different than the ones on the top. You were taking it from the side, which didn't have those features like those receptors that would bind to the hormones. So it wasn't going to happen on the side or the top. You could transplant it on your nose if it
And
came.
it would grow there.
And it would grow. No matter, put it on the palm of your hand. It would grow anywhere you put it because that hair was safe from the hormone. And but years later, there was a well-known doctor in New York who made it more popular in the late 50s. And then it went from plugs, and by the time I got to my training, some of us said, yes, you can grow hair, but it could be better. And so what actually happened was there was a woman that was the wife of a surgeon at the hospital, and she had lost quite a bit of hair in front of her ear from a facelift in the old way and in some other areas. And she said to me, I was much younger then, she said, I've seen other people. One fellow said I should put plugs in there. And I said, well, that would look fake. And somebody else said, well, they should do a flap of hair to rotate the hair forward. And I said, that would be too thick. It would look like a bush coming out of your head. And she said, well, what would you do if I were your mother?
Nanny. Last week was Nanny's birthday.
Yes, it was.
Happy birthday, Nanny.
And we all celebrated. Not everybody is missed. Nanny is missed.
Nanny's missed. Yeah.
Yes. I never heard Nanny raise her voice. She was always smiling, and she always had a good word for everybody. So
Yep.
when I was growing up, my friends always wanted to come to my house because my mother was happy.
Yeah, she was.
And she didn't yell. And she made everybody feel welcomed. So, Nanny, we miss you. And she said, well, what would you do if I were your mother? And I said to her, you're not old enough to be my mother, but this is what I would do. And I would take a little ellipse of hair, a little excision from the side, because the side's hairs are finer, and they match the hairs closer to the front of the face. You wouldn't take them from the back because the back are too thick. So we took a strip of hair, but before we did that, she said, what's the downside? And I said, the downside is nothing. If it doesn't take, you have the same scar. So we haven't lost anything. She said, all right, then let's do it. And we took a little ellipse of hair, and we cut it and closed the scalp. And then by hand, I cut up these hairs with a dissecting microscope into 1 and 2 hairs at a time, because hair actually grows about in follicular units, it's called, 1, 2, and 3 hairs at a time. And if you cut it up under a dissecting microscope, you cut it in a way that nature intended. And then I chose the hairs and I put them into her, in front of her ear, those fine hairs that women have, and they flip over their ears. And I put them in through a needle, one at a time. And the dogma back then was you can't cut it up and it'll never take, because you're going to damage the DNA. And what we also know, there are stem cells right above that follicle at the bottom of the hair shaft, which they call the bulge, where the stem cells are. And that's a source of research now also, which we can discuss. But the point is, we put it in and we waited with our breath held for the next 3 to 4 months, because it usually takes 3 to 4 months for hairs to get back into a growing stage after a hair transplant. And lo and behold, they started to grow.
And that was the first one that you did?
That was
in
the
that
first
style?
one, and I am not aware of anybody having done it before then.
So he invented it.
Well, very often many people have the same idea, but I'm not aware of anybody doing it before then.
Very cool.
So, and if there is
And I've watched that process, and it takes like 8 hours sometimes. It's fucking insane.
It's a long process, but it's not a painful process. And
they're under anesthesia. They talk the whole time.
It's just a local anesthetic.
He plays disco music.
All kinds of music.
It's a lovely process.
Well, I have very nice patients, and we get to talk about a variety of subjects. But at the end of the day, it's the result that matters.
Totally. How do you feel being a doctor who does hair transplants to so many people, and you have no hair?
It's interesting, because I used to say, and maybe I'm exaggerating, of course, I used to say, never let a guy with a full head of hair transplant you, because I don't think they're as sensitive to the subtleties. How do you make less look like more? People play with the hair all the time with different hairdos, but there's a point where it becomes ridiculous. And how do you make a transplant look as good as it can without doing, multiple. In the old days, you needed many, many sessions to make any progress. Now you can get a lot done in one session, but it always depends on the donor hair. If they have good donor hair to work with, you can get a lot done. If they don't have a lot of the good donor hair,
How do you feel?
how do I feel?
Yeah.
I'm okay with it because it was a learning process for me. And back then, I did not like what I saw. That's what got me interested. There were many good doctors then, but it wasn't something for me. I didn't like the way I think I have a very discerning eye, as most surgeons think they have, and some of them do have better than others, and some.
And you wouldn't want to go to not you.
I just didn't care for them at the time, and we used to have the conversation all the time. And I told them the same story, and I said my father didn't have any hair, and I wasn't that affected by it.
He had a ponytail, though.
Yes, he had a little ponytail, and he was 6 feet tall and blue eyes and very handsome. And so to me, it was always something that was okay. And then my mother's brother didn't have hair, and my father lost his father when he was young, but he didn't have any. And my grandfather, my mother's father, was sort of just like me. So I was somewhat genetically challenged, though there are members of the family that have some decent hair.
But everybody you generally looked up to.
Yeah, it
was
was okay.
bald.
It was okay, but it certainly piqued my interest.
Yeah.
And if I were to ever do anything, it would require, a discerning eye. And to make a good hairline was the key. Good hairline, good transplant. Bad hairline, doesn't matter how much you put up there. It's something that generally you wouldn't want on the top of your head. And so I would sit with patients still nowadays and sit there putting in single hairs and randomizing it, because a hairline isn't straight. A hairline, actually, if you look under a microscope, is kind of sawtoothed up and down. And if you have that irregular sawtooth pattern, it's going to look natural. But you never want anything that's reproducible. They always say that the first thing your eye will pick up is a circle.
Yeah.
And that's why you don't want to.
Yeah, I don't have a circular hairline at all.
No one has
Most
a
people
straight.
don't, except the Kardashians, who got them like lasered that way.
Well,
I used to shave mine. Charlotte used to make fun of me.
Well, to each his own. But I think that it's a good option. So I remind people when it comes to hair, for regular male pattern hair loss, because you don't transplant alopecia areata.
Yeah.
But for typical male or female pattern hair loss, I always tell everybody
Human pattern
there are
hair
lotions.
loss.
There are
Yeah.
lotions. I participated in the first Rogaine study. There were 27 centers. Did it do something? Yeah, it was a very good beginning. And then you had pills, and the pills, were Propecia was first. There's Aldactone that they use in women. There's Avodart, which is a variation of
Didn't I take
Propecia.
Aldactone for skin?
Yes, Aldactone reduces, if A goes to B, and B is the problem, it makes A go in the opposite direction. So by reducing DHT with Aldactone, it will help clear your skin in women. It'll help your hair in women. And
Female-bodied people.
it would reduce, and the right enough of a dose, you can also reduce body hair. So isn't it crazy that the hormone that causes the hair on your head to fall out causes hair on your body to grow?
That's crazy.
And it's the same hormone that causes acne, and the same hormone that makes the prostate grow and make your skin oily. So there's a lot of things that this hormone can
We had a question
invoke,
about hormones, because a lot of people have PCOS.
PCOS means polycystic ovarian syndrome. And it's well known.
And hair loss is a symptom.
Hair loss can be a symptom. Acne can be a symptom. To make a proper diagnosis, you need a sonogram to see that they're there. It often has an irregular menstrual cycle. And in the hands of a good gynecologic endocrinologist, you can do a lot to treat it. But yes.
But what about the hair? Like,
But
how
hair
do you
loss is
tackle
part-
the hair loss?
Well, in the same way, in women, they'll often use the Aldactone. They'll use the Propecia or the finasteride. It can be 1 or 5 milligrams. Finasteride is the generic name for Propecia or Proscar. Avodart, again, all of these things are what you call off-label in women, but the gynecologic endocrinologists and the dermatologists are all familiar with this. And you want to manage the polycystic ovarian disease while you're managing the hair loss. But yes, it's sort of a collaboration between the different specialties. But does it help? Yes, it does help.
Mm-hmm.
And some of them are transplantable. Not everyone with PCOS is transplantable. It all depends, once again, on their donor hair.
Mm-hmm.
The hair is treatable to a point, and it varies from person to person. Some people,
And you should do it with your doctor.
You should. They should collaborate, the endo and the derm.
Okay. I'm thinking about a lot of people who are transitioning as well, because like we have been using like men and women, but obviously there's many genders. And one of the questions that we got, which I was very interested about, was how to stop hair loss on masculinizing HRT. So this guy is trans, assigned female at birth, and is on HRT to transition. Yeah, and is losing hair.
That's not an easy thing to address, because they're on the hormones that at birth they were genetically predisposed, but being an XX, they were less likely to lose the hair. And then in the transition, giving more testosterone and other hormones, more androgens, yes, it would definitely play a role. Not always. Depends on what your genetic predispositions are. That's a very challenging situation, and that's where a collaboration between the endocrinologist and the dermatologist is critical. And I think it would vary on a case-by-case basis.
Okay. And also, I feel like maybe it could be gender euphoric because you wouldn't have balded before, but now you're going through something that a lot of men go through, which is balding.
I think everything is how you approach it. Life throws you all kinds of curveballs, and how you approach them and receive them is critical. You know, people lose hair and they manage just fine. People lose hair and they're very unhappy with it. They want to do anything and everything that can be done.
Yeah.
So some people don't like their nose, and they will
get two
fix
nose
it
jobs.
no matter what. And
And
some
want a
people,
third.
yeah, and some people, you know, will say, "Well, I look just fine." So
Yeah.
it's how you receive it, and rather than how others receive it, it's how you receive it. And there's the psychiatrists can talk endlessly on this subject, but I think that you have to like yourself.
True. You said that you can transplant to any part of the body, technically. Have you ever had somebody who wanted more beard? Can you do that?
Yes. I've had a couple of people over the years that have had facial injuries. One was a very famous fellow who had these round, coin-shaped areas of alopecia, but they were not coming back because it was an injury. They were scarred for good. And I actually took the hairs from his head that I thought would be the best match.
Coarse enough.
And I literally, exactly, the same caliber as bearded hairs, or as close as you could get. And I literally transplanted about a half a dozen patches in his face. And that was many years ago, and it has been very successful, and it's still there. And because if you have a beard and then it grows, you see these patches, so you have to shave very closely. But if you have a 2-day growth, you don't want to see them. And if you like to wear your beard, 2 or 3 day growth, then it's necessary to fill in the scars.
Yeah.
So just
or
as
some people just don't, like Tim doesn't grow a full beard. And
some
would
people
like
never
some
had
people
a
are
full
like,
beard.
I can't connect.
But that's okay, because that's the way they look. But we're talking about somebody who generally has a good beard with these empty spaces, and those need to be filled in. The people who have a light beard, that's just their pattern. But yes, I've transplanted faces. There are some people who transplant eyebrows.
If you had no facial hair and you wanted a beard, is that transplantable?
I would discourage them.
Okay. Are there any topical products that you recommend to people who aren't like balding, but they're maybe thinning?
Yes, well, it started with Rogaine.
Okay.
Rogaine was the first, and there was a 27-center clinical trial that showed that Rogaine did do something. Rogaine was originally a drug for high blood pressure.
But there's no like natural oils or like vitamin E. Crack open on your head.
People have all kinds of experiences, and some people believe that taking certain supplements will help your hair. I believe the supplements will help if you're lacking in certain things. Are you anemic? Low iron, low folic acid, omegas, some people believe are associated, that could help hair growth. And so there are many, many supplements on the market. Do they help? Again,
Wait, so low iron and folic acid causes hair loss?
Anything that causes anemia. Anemia can contribute
but
to
I'm
hair
anemic.
loss. Well, that doesn't mean you're going to lose your hair, but sometimes it's associated. There's some of the minerals that are associated with hair loss and hair growth. Too much mercury, if you eat a lot of sushi, will the high mercury level contribute to hair loss? It can.
Interesting.
Zinc plays a role in hair loss. Will low zinc cause you to lose hair? It might. So sometimes zinc as a supplement is helpful. So there are many supplements on the market. Some people swear by them. Some people say they haven't had any benefit from them. I think it's a case-by-case basis. But if you're lacking in one of the ingredients, then sometimes it'll help. If you're not lacking, it's not likely to help. Now, there have been many medications that people have used over the years.
Can women use Propecia?
Yes, it's
Cool.
I don't believe that it's yet been approved by the FDA, but people have been doing it off-label for a very long time because the company that made it didn't do a classic clinical trial, but studies have been done and shown that it is effective in women. By the way, and some of the very best studies on women have been done by very reputable women, and those studies are very accessible. And well, it's nice when women do studies on women.
They
always,
need to.
It always appears to be less biased. These are very credible, very famous women who have done the studies and have shown how it's efficacious. And in medicine, doctors are allowed to use their judgment and use drugs for things other than what they're approved for. But the manufacturers, the pharmaceutical companies, are not allowed to promote it for off-label things. That's what they call off-labels. For many years, doctors were using aspirin for heart disease, knowing that it had some value, and but it took time before it got approved for that reason.
Okay.
So yes, it's efficacious in women, and the literature is replete with studies by reputable women who have done the work.
Okay.
So what you're trying to do is reduce the conversion of A to B, or testosterone into dihydrotestosterone. They're just long words for A to B. And if you take Propecia actually started as a drug for treating men who had large prostates, not cancerous prostates, but large prostates. And they were taking this pill by mouth that would reduce the conversion, which shrunk their prostate glands down, the benign prostate glands, but they shrunk them down so they didn't have to get up and go to the bathroom 4 times a night to empty their bladder. But lo and behold, not only did it work on their prostate, but they had an added benefit. So I don't even call it a side effect. I call it an added benefit because their hair was growing, and most of the men who were taking it noticed it. So then they did another clinical trial, and they found that the 5 milligram pill that was used for the prostate is no longer necessary, and the 1 milligram pill was enough for the hair.
Okay. So we talked about how to do natural hair loss. What about like alopecia?
Well, alopecia just means hair loss.
It just is hair loss?
This means hair loss, alopecia.
But what's it
alopecia
caused by?
areata,
Yeah.
which
it's just
is the name
little
of the
areas.
disease. Right, little areas of hair loss, but that's not hormonal. Alopecia areata, well, let's give a little history. It's generally 2% of the population that get this alopecia areata, and they get these round bald spots in the earlier stage, but that is retrievable most of the time. I would say 98% of the time you can get those patches back. A small percentage of those people need more aggressive therapy, and that's another discussion. But generally speaking, alopecia areata, when you get the round bald spots, are caused by antibodies attacking your own hair. Now, why do you attack your own hair? That's what we call an autoimmune disease. And there are many autoimmune diseases, and some are life-threatening, and some are more cosmetic. And, they're beauty problems. But losing a patch of hair is not a problem. Losing all the hair on your head is called alopecia totalis. And losing all the hair on your body is called alopecia universalis.
Yeah.
And so... That's right. So now, meaning everywhere, universal. So, but now you can treat the patches, usually sometimes with topicals, sometimes with small little injections, which don't hurt. And but as it gets bigger, there are other things. Sometimes there are medications that you can take orally for the more extreme causes. And one of them was a drug that was developed for rheumatoid arthritis. This is for the more extreme form, and it works on certain genes called JAK genes, J-A-K, JAK1, JAK2, JAK3. And these genes also play a role in vitiligo, where you lose pigment.
Yeah.
And it plays a role in eczema, where you itch and scale in a variety of places on your body, but also alopecia areata. So they're all thought to be autoimmune diseases. Where
Skin
for some
diseases, though?
a skin disease like
So
eczema.
you would go to a dermatologist for alopecia.
You would go to a dermatologist for alopecia and for eczema and for vitiligo.
Obviously, eczema and vitiligo.
Correct. And that's the drug. One of the drugs is called Xeljanz. And, and it's and the other one is called Jakafi. But both of these drugs work on these genes, and by suppressing them, very often the hair grows back. And we do have some patients that are using it where everything else failed. These have been successful. So this disease, which has been a very great challenge for as long as anyone's tried to treat it, not such a big deal in the limited stages. And I would guess that's about 98% of the people. But for those 2% that are more challenging, and there are a lot of people, 2% of the country who get this would be over 6 million people who get it now and then. They don't have it all the time, intermittently. But 2% of that number are the more extreme, and it's nice to have something to offer them that is reliable. And so far it appears to be relatively safe. So,
how do you know if you're balding from alopecia or naturally, or
well, natural hair loss has a pattern, like in men, the receded, the bald spots.
And then the
horseshoe.
alopecia is just the little dots.
They're like the round spots, yes. And, you can biopsy
It's like the
them.
ringworm.
Most clinicians can recognize which is which. There are some situations where it's a little less clear, but most of the time it's clear. And if you biopsy them, you will see differences under the microscope, which helps you make, a more definitive decision. And, then there are scarring alopecias where you can't grow anything back, so you just want to prevent it from spreading. Those scarring alopecias are like things with fancy names like lichen planopilaris, pseudopelade, frontal fibrosing alopecia, which is we're seeing more in women these days. You just want to stop that from spreading further, because once it's scarred, these scarring alopecias, it's not retrievable. There's even a lupus of the scalp, which doesn't kill anybody, but it's it's another challenge, because it's another cause of hair loss that is not retrievable.
Yeah, interesting. If hair loss is a side effect of medication, will it grow back when people stop taking them?
Sometimes, yes. Usually, if it's there are certain medications that will contribute to hair loss. We know that you lose hair from chemotherapy, that grows back.
Yeah.
That's called an anagen effluvium as opposed to the telogen effluvium. But yes, if the medication is, but not always. Sometimes women taking testosterone to augment their sexual desire. There are some doctors, it's controversial.
Wait, women take what?
Sometimes they take small doses of testosterone for their libido.
Oh.
And there's some disagreement here. Some doctors think it does contribute to the hair loss in women, and some don't. I personally believe it does. And but when you remove that, it should help to grow it back. But sometimes it doesn't come back 100%, but it should be helpful. So it's always a balance. What's the risk? What's the benefit? And those are decisions that physicians have to make with their patients.
Yeah. And take a full history and maybe talk to other doctors.
You need to always have a complete history and physical and blood workup.
Yeah.
And then you need to speak to the people who've taken care of them for a long time when necessary. And the more information you gather, the better you can serve the patient.
Yeah. What about hair loss due to stress?
Stress can cause many problems. Yeah. It can aggravate your psoriasis. It can aggravate eczema.
When I had the viral exanthem?
Oh, yes.
That was stress-induced?
You were studying for the SATs.
Yeah.
But yes, stress will aggravate psoriasis, acne, eczema, hair loss, hypertension, diabetes. There's a million things. And, generally, how do you measure stress? But there are ways now, given all the immunologic testing, to kind of measure it indirectly.
Well, when your hair starts falling out.
Well, you take a history and see if there's a family history, because there are people who lose hair from excessive amounts of stress, and they have
generational stress at a certain time in their life.
but they don't have any family history. And it appears that stress can cut the hair cycle short. So rather than a 2 to 6 year cycle, it gets less and less and less. And so, yes, I'm one of the people who believe that stress can cause hair loss.
Yeah.
Pregnancy, pregnancy is a form of stress because you're going through a big delivery, and usually anywhere
Making a human.
After a couple of months that those women will shed, but that kind of hair loss comes back. The telogen effluvium, it's just a fancy name for hair in its shedding stage. Usually 90% of your hairs are in the growing stage, the anagen, and 10% are in the shedding stage, telogen. But if that 10 goes up to 20, 30, or 40, you're getting clumpy hair loss. And that can happen from stress, especially over a long period of time. It can happen from giving birth. It can happen from surgery, anesthesia, high fevers. There's a variety of things that you can get this form of hair loss from, but that will come back if you remove the stress, whether it was surgical or emotional.
Interesting. You just remove the stress. Go on Lexapro. Quit your job. But it's nice. I think that's a stress relief, probably for people who are losing it due to stress, that it can come back. Like,
well, does stress find your Achilles? Is your Achilles your predisposition for hypertension or diabetes or acne? Most kids will tell you when they're studying for big exams, they may break out more. They may get a cold sore that they usually don't get because their immune system has been compromised. But over the last few decades, we've become more sophisticated in kind of measuring the immune status.
are there any things that would lead to your hair falling out, like a tight ponytail or wearing a hat every day? Are those like real concerns?
There's a thing called traction alopecia. If you wear your hair very tightly or you braid it very tightly, you can reduce the blood supply to those follicles. And yes, you can lose some hair from that if it's done chronically. It's not something going to happen in the short run. But yes, you know, there are people who always braid their hair, or again, anything that puts tension on it. You can lose some hair over a long period of time, yes.
We got this question. It said, when do you worry about shedding, especially for women of color? And I tried to look up if hair loss is more common, but that makes sense if people are braiding tightly a lot. So when would you start to worry if it's like not a normal pattern of baldness? It's like going with the hair. And what
from traction, from braiding? Well, when do you start? Because you start thinning around that area. And what can you do? Well, when you are reducing the blood supply, first thing you advise is to take
out the braids.
Take them out. You know, sometimes you will treat it as if it were male or female pattern, because using these medications can reduce the hormones that could be a problem. But you also want to do something to try to replenish the blood supply. And one thing people are using now with varying success, sometimes it seems to be quite helpful, sometimes not so much, is PRP. PRP is called
platelet-rich plasma.
Correct. And the platelet-rich plasma is exactly what it is. There are platelets. You take your own blood, you spin it down for 10 minutes at about 32,500 RPMs, and the red cells go to the bottom, then the white cells and the plasma's on top. And the plasma that's rich in platelets are at the bottom, and you take that, you remove the platelet poor plasma from the top, and you take the platelet rich, load them into syringes, and put it back into the scalp. And it was originally...
And who does those, derms?
Derms do that, yes. PRP was actually originally developed by a dentist to put into gums and bones to make them healthier, to put in implants. And then there was another doctor in Germany who was doing it to inject into Kobe Bryant's knees and A-Rod's knees after an injury. And so to prevent it from becoming arthritic, you wanted to inject it so it would heal itself. And
rejuvenate.
That's right. And then the derms started using it for hair loss, for wrinkles, for stretch marks, whether they were from pregnancy or from weightlifting. But in the hair, there's 8 different growth factors in the platelet-rich plasma, and one of them is called VEGF, vascular endothelial growth factor. And if you inject it into the scalp, it's hopeful that it will help improve the blood supply. And if it does that, the hair might become healthier. And as I said, it's all over the internet, and many people are doing it, and sometimes it's very successful, and sometimes you don't see that much. The quality of the PRP, I think, varies from person to person. We used to think young, robust male blood was the best, but I find that so far you really can't predict. But interestingly, there was a study years ago done on rats, and I remember a woman presenting it from Harvard, at the Aspen Institute, and she was showing if you took the serum from an old rat and gave it to a young, and then the young rat to the old, over and over and over again, the old rat became a little bit more with it.
A little more spry?
A little more spry. I think his mentation was clearly better, and he was more robust. And the younger one was less so. So there's clearly something to these growth factors. And to take it another step, there's a lot of stuff on the internet about something called exosomes. And exosomes are like little vesicles that are inside a stem cell, which I said is at the bottom of the hair shaft. And there are some studies going on now. We're not doing it in the office yet.
Okay.
But we are observing and trying to put together everything that's available. But these are little exosomes exiting bodies, exosomes. And these exosomes leave the stem cell, and they carry 300 growth factors. And how successful will that be? Well, it may be more so, and it needs a lot of study. But right now, eventually they're going to get it out of your own blood. But there are just one or two companies now that are taking it from amniotic fluid, where they are teaming with, it's a sort of a privileged environment, amniotic fluid. And
because you need to have a pregnancy to get it.
Yes, but generally it's not bacterial, it's sterile, not viral. And they are there are some people doing it now. You can go on the internet and read about it. But exosomes may or may not. We never know. I'm always hopeful. But it seems like it should have a place eventually. There certainly appears to be some value, but, we will know more within the next year.
Okay.
And, take them out. I probably think some PRP would be helpful to revascularize it. And as I said, sometimes the medication that we suggested can be helpful in giving it a push.
Yeah. Go natural for a little if you can.
Yes, that would help.
Maybe
that would make my job easier.
Yeah. Some people were asking if they have a dry scalp. Is that the reason why they're losing their hair?
No, I don't think. There are certain inflammatory conditions of the scalp that can make your hair thin, but a dry scalp, really, unless it's causing a certain amount of inflammation, discomfort, usually is not responsible, and there are ways to treat that also.
Can your hair thin and change thickness and texture from childhood to your 20s? I say yes.
Sometimes hair texture will change.
Texture, yeah, definitely.
Hair is protein, and protein is made up of amino acids, and the main amino acid in hair is cysteine, and cysteine create these disulfide bonds, and these disulfide bonds, can be intact, or sometimes when you wash your hair, they're broken temporarily, and then when you dry them, they form together. So when you're trying to style your hair, you're trying to get these bonds to reform in the position that is more attractive for your hairstyle.
Yeah.
But can they change over a lifetime? Yes, I'm sure circumstances will change them. And
my hair texture has changed a lot over my life.
And in what way?
Well, it was very straight when I was a baby. And then at 2, it was super curly. In fact, looked like yours, little peninsula with a lot of curls in the back. Then when I was 3, 4, it was super straight and long but curly at the end. And then in puberty, it got really wiry and coarse and wavy. And now it's pretty wavy, but I can also let it naturally dry and go out. And I would never have been able to do that in high school.
I do believe you're right, and I can change given different circumstances, but that's the essence, these disulfide bonds Again, hair is protein. Protein is made up of amino acids, and the main amino acid is cysteine. But what if somebody's not getting sufficient protein? What if they need to? They look at their blood studies and they see that the protein is low. Will taking supplementary protein help your hair as far as retaining it or making it thicker? Well, there are arguments that say so that's possible. So again, when you're evaluating someone, you want to see some blood workup.
Okay, and does wearing beanies, tight hats, contribute to hair loss?
I don't think wearing beanies really contribute to it, but as long as it's not putting excessive traction on the hair.
Richard asked that question, and he said, what if it completes the outfit?
Then I would wear it.
Then wear it. Also, though, when balding, you have to adjust hairstyle-wise, because I think a critical thing is like when people pretend they're not, or they do like these like swipe overs or comb overs or whatever.
I have seen people do the most creative things, and I remember seeing two guys on the street, and they both had their hair combed from just above the ear over, so they were sweeping, and I call that a banker's haircut because they're borrowing, and it's funny because you could see they were both trying to negotiate the right position on the corner because the wind was blowing. So they wanted to be in the right spot, so the wind was blowing in the favorable direction, not the direction that would lift their hair up. So people can be very creative, but at some point, most people get tired of dealing with something that is too challenging, and it takes too much time during the day.
Yeah.
And at some point, people who are sweeping it over will either just stop it or they'll comb it back.
Yeah.
And they'll make it easier. There are people who continue to do it because that's their preference, and those who just say this is not worth it and they'll just give up.
Yeah. I dated a person who had a receding hairline, and I remember the way that he wore his hair was not very conducive to the hairline, and mommy would all the time be like, just brush it back.
Yeah.
Brush it back. When did you start brushing yours back?
I have to think about that. I have to look at photos, but
There's definitely some lab coat photos where it's still going to the side.
It was definitely after I went into practice.
Yeah.
Long after I went into practice.
Yeah.
And because when I was through my residency, I was still partying, and then
Parting, not partying.
Partying, not partying. I didn't
Never
party.
party.
I studied. But I, not too many years into my practice.
Already in practice. So a few years after starting to lose and recede.
I think I started losing at about 17, but you don't really notice it until you have lost a certain amount. Some people say you have to lose about 50% of your hair, not on your whole head, but 50% in a given area before you can tell that it's thinning. And so my hair loss was incremental, little by little by little by little. Then I got to the point where I no longer wanted to part it because I thought I'd have to move the part, which I wouldn't do.
Yeah.
And so then I just slicked it back and called it a day. And it was fine.
Get
because
some Phytoplage.
Phytoplage is one product.
A nice Mason Pearson brush.
There are many great products to keep your hair in place. And... but I don't think there's just one product for everybody.
I thought Phyto was for like enriching it.
There are many Phyto products.
Oh, I have one more question.
Okay.
Does the quality of water from the country you live in influence it? Because mine felt more blank than blank. What country is this?
I can't tell, but I can tell you one thing. I do think the quality of water does affect your hair.
I do too.
Some of them that are very... there's I'm sure a lot of contaminated water around the world.
Yeah.
And the heavy metals are not good for hair. As I mentioned before, eating sushi every day and having high mercury levels is a problem. I'm sure lead is a problem. The heavy metals are a problem. So hard water or water that's contaminated can not only have a detrimental effect on your hair, but the rest of your health. So if someone thinks that there's a problem, they should have their water checked. I would say even in places where perhaps, where pipes haven't been changed for a long time.
Yeah, for sure.
Or they're very old, and are they lead pipes or anything that could be unhealthy. So
Do you remember when I said you called me during lockdown and I was in Portland and you were like, how is it over there? And I was like, my skin is better and my hair dries better and feels better and feels healthier.
I think,
And he didn't like me being gone, but better hair was a fun thing to hear.
well, but I do agree with your assessment. All of this,
Yeah.
you know, people have to trust their own judgment. If they observe something,
Yeah.
then it's probably true.
Yeah.
And then you have to figure out why, you know, see what's going on. There's something called your genetics, which we know what that is, your genome. And just as an aside, we have 21,000 genes, and more or less. And there are about 3 billion base pairs or 6 billion units making up these 21,000 genes. And if you think that something is that you're doing is in any way detrimental, yes, you should follow up on it. Trust your instincts. But there's something called epigenetics, not your genes. The epigenetics are sort of the environmental influences. And those environmental influences can be altered. And they can be corrected if they need to be. So again, you know, people need to follow their instincts. If they
Nature and nurture.
Yeah, if they think there's a problem, there probably is.
Yeah, that's good advice. Cool. I think we've asked all the questions.
I think
So
that all
exciting.
of everything that we've said and discussed will probably generate a lot more questions.
Probably.
And if it does, you know, we can answer them at another time.
You would be willing to come back and answer more questions?
Yeah, I would be very happy to.
Cool.
I liked your questions. I like what
The Cumpanions wrote in.
what people wrote in. And as I said, the more we study here, the more there is to know. Like everything else, every field is exploding with more and more information. And the more we know, the more successful we can be in treating people as best as possible.
Dee Dee, it's been so lovely having you on this podcast
Thank you, Remy.
and being raised by you.
Thank you. I did the best I could.
Has it been nice raising me?
It's been charming. It's you know, Remy, when she was little, when her mother was pregnant with Charlotte, on a Friday or Saturday night, Remy and I would go out, and Remy would dress just beautifully. When she would put on her red coat in the wintertime and a little red beret, and she looked so dapper. And
so
not
French.
dapper, she looked beautiful.
And
with
dapper.
And with her long blonde hair that was wavy. We used to call her a fairywinkle.
Mom only started calling me Fairywinkle because Spencer was calling me nudist so much, and she wanted a nice alternative. Well, this has been so lovely having you on this podcast.
Thank you for having me, and I hope it wasn't too much information to digest at once.
I will edit all of the stuff out that people won't understand.
Okay.
I have to ask you this question after an experience on How Come. Joel Kassimir, Dr. Joel Kassimir, did you finish?
Always finish.
Great.
Everything I do, I finish.
Great. Thank you so much for coming.
Thank you.
All right. And we'll see you guys next time on How Come. Goodbye.
Goodbye, everyone. It's been a pleasure.
Bye-bye.
Bye-bye.
It's not you, it's me. I try so hard to finish honestly. They say you'll know when you go all the way from A right down to O. Oh no, I think that I still got a ways to go. Oh, I'm sick of this and I have got to know. How come? How come? How come I can't achieve? How come I can't achieve? I'm rolling up my sleeves. I'm rolling up my sleeves. Oh baby, I believe these guests can help. 'Cause I can't do it by myself. I wanna just...
How old is Dylan? We've
29.
never met. 29.
Yeah.
And how much hair did he have left?
Like an okay amount.
Well, it's interesting.
Wait.
It's interesting that he chose to shave his head.
But he's on Propecia too.
Okay.
Yeah.
Well, that's even more unusual because if you're taking Propecia and you shave your head,
Yeah.
it's a little harder to know how you're responding.
But you could like be surprised one day.
Yes.
Right?
Yes.
Like Propecia or shaving, it's not going to interfere with what the Propecia is doing.
No.
Yeah.
No. Shaving your hair only makes it shorter.
Yeah.